Thank you so much. This is a great honor and an incredible pleasure to be here at Chicago among you. I am very touched. Today, I would like to briefly discuss with you why we believe that immunotherapy could be a new hope for patients with brain tumors. The immune system is our defense system. Usually, it is seen as a very efficient system to protect us against external dangers as bacteria or viruses. But does the immune system also protect against cancer? The answer is definitively yes. There are several arguments supporting this sentence. First, and we will see only a few one. First, the incidence of cancer is increased in all situations where the immune system is compromised. You have a small list here. Second, we know now that the immune system has T lymphocytes, which are really killers. As you can see here, with a few T cells attacking tumor cells and destroying these cells. We also know that these T lymphocytes are able to invade tumor. T lymphocytes are here stained in brown in a tumor which is in blue. So they are able to invade this tumor. We also know that lymphocytes may, in some situation, mediate spontaneous regression, as you can see here in the case of melanoma. If you see which type of cells are there, you can see a lot of T lymphocytes specifically recognizing antigens presented by melanoma cells. So how does it work? You can imagine immune cells as patrolling in the body. If you can just say that, sorry. So the T cells are patrolling into the body when there is no tumor cells is not attacking. But of course, if there is some abnormal cells, they can recognize these cells and destroy them. It's obviously a very easy way to present that. So if we know that there is a natural property, could we exploit these natural properties to develop cancer immunotherapy? The answer is, again, definitively yes. And we heard about the story of PD-1 just a few minutes ago for melanoma, but also for lung cancer now, and other approach for prostate cancer. And the question we address since now several years is whether it is possible to develop such type of therapeutic approach for cancer arising in the brain. Why it was so interesting. Brain tumors, and we heard about a very strong message 1 hour ago. Brain tumors is definitively the first cause of cancer deaths in children, the third cause of cancer deaths in young adults, and it is a devastating disease at any age. As you know, the brain is governing everything we are doing, running, thinking, writing, but also the balance of the body, emotion, love, and behavior. And despite some advance in the last 10 years, there is still a lot to do. Excuse me. Introducing the combined treatment between irradiation and temozolomide, you can see that there are a few long-term survivors, but only a few long-term survivors. And there is a lot of things to do, and we need other strategy. The initial observation we made in this direction was nearly 20 years ago, was that glioma, so brain tumors, are actually infiltrated by T lymphocytes bearing the same receptor. The same receptor, a peak like that means that all the lymphocytes express the same receptor, meaning that they are trying to recognize something. It was the initial information at a time where it was thought that the brain was totally isolated from the immune system to avoid autoimmune attack. And then we decided at that time that we need to identify what is recognized. It was a difficult task, and we did not succeed for the first 15 years. During that time, we nevertheless contribute to understand the rules of the anti-tumor immune response into the brain, because the rules of the immune response are different in the brain than in other parts of the body. And to summarize 15 years of the work performed by Paul Walker in my lab, there is one slide showing that tumor cells growing in the brain are recognized as a danger by some specific cells located in the brain, and these cells are actually able to migrate to the cervical lymph nodes, where they present tumor small parts, which are called peptides, to lymphocytes, to the same T lymphocytes. T lymphocytes are activated, they proliferate, and they are also educated during this interaction to migrate and to enter the brain, and hopefully to kill the cancer. Of course, this is an ideal situation that can occur, but it doesn't occur when the tumor is growing, because we also identified a lot of mechanisms by which glioma may counterattack the immune response. So there are several mechanisms of immune escapes that are used by glioma, for example, by producing soluble factors that are able to kill the tumor cells, or at least to reduce their efficacy. But there are also a lot of transmembrane receptors, which, and for example, the B7H1, which is nothing other than the PD-L1 we heard about a few minutes ago. And this, by doing this, glioma may also, by hand-to-hand interaction, inhibit the immune response. So we can see with these two slides that we are not in a on-off reaction, but we are rather in a fine and delicate balance. And of course, the goal of immunotherapy is to tilt the balance in favor of the immune control, in contrast to the immune escape. But in the specific field of brain tumors, the very important question is whether we can target and kill the tumor cells without damaging normal cells and brain function. You may be allowed to have some level of autoimmunity in the skin, in the prostate, but not in the brain. So this was certainly the absence of very well identified antigens, we will see what it is, was clearly the most challenging obstacle for the development of brain tumor immunotherapy. This raises the question of how different are normal and tumoral cells. A normal cell is expressing all its components at the cell surface, and you can imagine, you can see that as some flags. And just to give you an idea, each cell is expressing about 50,000 flags at the cell surface. And the goal of our research, the initial goal of our research 20 years ago was to try to identify whether there are one or two red flags that are expressed by glioma cells and not by normal cells. If it is the case, we can use T cells to try to treat such type of situation, because T cells are able to screen each cell of our body, and when a normal antigen is encountered, nothing is happening, but when a glioma or a tumor antigen is encountered, T cell is activated and tumor cells could be destroyed. In contrast, the same screening on the normal cells with no red flags recognized does not destroy the normal cells. And this is what has been achieved last year, mainly by Valérie Dutoit in the lab. And she was able, using very sophisticated techniques in collaboration with the Tübingen University, to identify not one, not two, but we are lucky to finally identify by peptide elution 10 glioma antigens, which are specifically nearly exclusively, not totally exclusively, but some were exclusively expressed, so other preferentially expressed by glioma cells. And so using our immune system to treat brain tumor, now clearly we move from dream to reality. After the surgery, which probably will be always necessary, at least to establish diagnosis, we hope that we can use our immune system with T lymphocytes as effector cells. They are not the sole cells, but they are clearly effector cells to kill the tumor cells in the brain. Two main approaches could be developed and are into development. The first one are therapeutic vaccine, and the goal of therapeutic vaccine is to use the antigens or the targets we have identified and to try to induce or to reinforce an immune response. As you can see here, like that, if you give the targets or the glioma antigens in a situation where you can create danger, we can hope that we can activate an immune response able to do the work. This first step is now supported by the Gateway for Cancer Research and for all of you, the donors, and I thank you very, very, very much. An alternative and probably a complementary strategy would be to use T-cell therapy instead to try to induce immune response in the body of the patients. T lymphocytes or effector cells are prepared outside of the body, but these cells all recognize the specific target we have identified last year, and those cells can be infused to the patients as a blood transfusion, and then migrate to try to target brain tumor cells. This strategy is more challenging. In our opinion, it's not yet ready for clinical use and needs still a lot of efforts, but probably both vaccine and T-cell therapy will be combined in the near future. And as you can see here with the team, we are clearly in the middle of the gateway between lab research and clinical development. I would like to thank you, this beautiful team, as I thank you, all of you. But to do that, I think that we need patients offering hope, motivation, and inspiration. And I would like to present a few of them among a lot of. Mary was an hiking guide in Alaska with lovely adopted children. She is now 50 years old. She was diagnosed 10 years ago with a very aggressive glioblastoma, which was very deeply located and not operable. She was paralyzed and totally disabled. She received a standard treatment combining irradiation of the brain and temozolomide, and she fully recovered. Had nevertheless 2 relapses, always treated with the same drug, and she is still alive. She is the mother of 2 beautiful teenagers now, 16 and 18-year-olds. She has an extraordinary spirit. She's giving hope to everybody, and she's offering love each day around her. This picture has been made a few days ago only. You can imagine how she is. And as Marjorie was a beautiful 45-year-old lady when she was diagnosed with glioblastoma. She was working hard, was in love with Jean, and still is, and loved life. But everything was interrupted 3 years ago. Now the disease is progressive, and she is ready to live. For 3 years, she gave so much, being always happy to meet people, providing love to his delightful parents, has so many friends. She is providing fun in our department of research and hope to other patients. She is giving us so much each day. Frederick passed away a few years ago. When the disease touched him, he was a very athletic guy, member of the Swiss team for volleyball. He was a very nice friend with a lovely girlfriend. He was suffering from a terrible glioblastoma, and all treatment we tried were unsuccessful. His life during the disease was terrible. He was hospitalized for around 1 year, and he was very sad during the last months of his life. However, he always tried to transmit love to his relatives, as in this picture with his young brother. Frederick is very present in my memory each day because I didn't succeed to help him, to provide him with some hope, with some light. I'm still trying to understand why. During the last months of his life, he often complained that our hospital was not able to have a space dedicated to young patients. This was true. Now his parents, his brother, and his girlfriend decided to create an association to support brain tumor patients and their families. And their first action is to build a space for young patients and their family in which young patients may have some interaction with their friend and family without nurses and doctors. His parents, brother, friends, and his past doctor are convinced that Frederick would be reconciled with the hospital, knowing that his criticism would be helpful for all young people now hospitalized at Geneva. Marietta, she is a 23-year-old patient diagnosed with a brain tumor 5 years ago. At that time, she was a funny girl. She still is. Her tumor was rapidly progressive after standard treatment, and we were very pessimistic. She always said that life is hope, and with an experimental treatment, she is now in complete remission for more than 2 years. She is living each day very intensively. She is traveling a lot, meeting so many people, and each person who has the privilege to discuss with her is impressed. She has the wisdom of an elderly person, the spirit of a Tibetan priest. At each of her visits in our department, everybody would like to see her, discuss with her. She is bringing us with an extraordinary source of strength. She is amazing, always wanting to testify how our life is now more intense than before. And finally, I would like to honor Mathilde. Mathilde was not suffering from a brain tumor, but from a terrible sarcoma in the liver. There was some hope to cure her, and thus the chemotherapy was very aggressive and difficult. She has three relapses in 3 years. Each time, she was able to recover and find resources to build herself up again. I never met somebody like her. She was fascinating and a beautiful spirit. She has extraordinary resources, was always smiling, was fragile and strong. She was a love within her family. I am convinced, she is now an angel. She has an endless source of inspiration, motivation, and humility. I really would like to honor her memory. And to finish, just summarize that the name I mentioned and the history I mentioned with Frederick, Marietta, so it's long, Mary, Marjorie, Pierre, and Mathilde. And of course, to continue on this way, and this is a little bit of personal view, I also need some personal support coming from my family. And I said in my biostech, my children, Damien here with his girlfriend Sophie at the top of the mountain, and my daughter Marion. I always say that they are probably the best experiment I never realized and hopefully succeeded in very close collaboration with my love, Isabelle. I thank you for your attention and your trust.